helping these moms and babies breastfeed and seeing not just how beautiful and natural it is, but how hard it is at the same time, and how emotionally exhausting it all.
Welcome to another episode of Word on the Street with your girls, Sasha and
Tanya.
So today we're super excited because we have a special guest. Annalis is an international board certified
Lactation consultant and also the author and writer of her first book, Latched. Annalis, welcome.
Thank you
welcome.
Super
excited to have you today.
I'm really excited right now. Thank you for having me.
Yeah, so she founded Latched. And Latch is based in Miami-Dade, okay? And it's supposed to be a safe, nourishing type of facility program for women who are for education purposes and to basically help
with lactation,
and beyond, right? And beyond.
Exactly.
Because it's not just about breastfeeding.
Exactly.
Right.
It's about educating women, empowering women, and helping families with babies,
right?
With baby care. So
So why don't you tell us a little bit about how you got started? What gave you this idea?
Absolutely.
Some background on this amazing work you're doing.
So Latched is the name of my private practice. I, like you said, I am a lactation consultant. So I also am a nurse. So I do have history of working with patients for many years, but during my time of nursing where I was working with mothers and babies, that's where I learned that that's my truest passion. That's what I was meant to do. I always knew I was meant to be a nurse, but when I was around moms and babies, I felt like my soul was on fire. This is your
specialty.
You know?
Yeah.
And not just that, I don't have babies yet, but I have this like intense passion towards breastfeeding.
Yeah.
And when I started helping these moms and babies breastfeed and seeing not just how beautiful and natural it is, but how hard it is at the same time, and how emotionally exhausting it all is, and all the above, I started realizing, oh my gosh, I want to make a difference.
Right.
However, I know I don't have the personal experience, but I've helped so many moms with this that I feel like I know how to breastfeed myself.
There's definitely a need for that.
For sure.
Yeah. Because some moms, I don't know about your experience, Sasha, but a lot of us moms, some of us, depending on how we even deliver, will determine our breastfeeding experience.
Absolutely.
You know? So, and what I mean by that, just for those of you in our audience that don't know, a woman that will give birth naturally tends to lactate fairly quickly after labor, whereas a woman that's had a scheduled C-section will have a completely different experience.
Absolutely.
And I speak from that experience.
Right.
For sure. That was a long time ago, but I still remember.
Yes.
That's how important this topic is.
Yes.
Yeah. And as women also, we're planners, right? Wouldn't you say? Some a little bit more extreme than others.
Oh yeah.
And the subject of breastfeeding versus just pumping versus just formula, like me, for example, I always said I wanted to breastfeed for a year, maybe 2 years. Maybe 2 years is pushing it, but that was my plan.
Yes.
Right? That was my plan. And, there's certain experiences, whether good or bad, that kind of are engraved in your mind. And that specific day when I delivered my son 10 years ago, actually it's going to be 11. My son's going to be 11 in September.
Okay.
I pushed him for like 6 minutes. 6 minutes and he was out.
That's
right?
awesome.
That's awesome.
Yes, it was amazing. Okay.
Yeah, I wish I could say this.
And at the time, they took him and they ran tests, etc. All the stuff that they do, right? Then it's time for feeding. I will never forget the lactation consultant came to the room, and she said, "Okay, well, your baby needs to eat, so you need to put him on your boob and have him latch and feed him." That was it.
That was it.
I mean, she stayed there to watch me do it, right? But I didn't, she said, hold him like a football and he'll latch. And if you can't do it on this side, do it on this side.
Okay.
everything went downhill from there.
I believe you. I believe you.
But for me, I didn't produce enough with my last son in particular, so I ended up with a catheter and a little one of those little mini baby,
look at that.
the newborn bottles
Yes.
up here, so that he could have double intake. Yes,
Yes.
he was a chugger.
Wow.
And so, you know, and I was just totally freaked out because then the
course.
Velcro with the tape thing, and it was just
And
like
that's
a whole...
emotionally difficult because then you kind of feel like you're not enough.
Right. No, and then
Absolutely.
the kid is like having a whole meltdown because they're trying to latch on
And they
it's
can't.
not enough.
Mhm.
And they can't.
So, I mean, this is
So
a big deal.
Speaking of, I like that you guys are using the word latch. So as you see, my practice is called latch.
Latch,
Mhm.
right?
Because in my professional opinion, when it comes to lactating, breastfeeding, breast pumping, the latch is the most important part.
Of course.
If you don't have the latch correct,
Forget it.
it's not gonna give you the results that you want. Many moms, it's unfortunate, like that lactation consultant said, latch the baby and do this. Many moms think that they're latched correctly and the baby is literally just on, I'm gonna say sensitive
just-
words,
yeah.
nipple. Okay, I know some people don't like to talk about nipples,
Yeah.
but we're gonna talk about lots of
Yeah,
nipples
yeah,
here,
yeah.
okay? But a lot of babies latch on just to the nipple, and the whole time the mom's thinking, oh, the baby's latched, perfect,
Right.
and then a day later the baby lost over 10% away, and they're like, what do you mean? I thought I've been feeding my baby this whole time, and turns out it's that the baby wasn't latched correctly.
Okay.
So I came up with the name Latched because I'm here to educate you before you even deliver.
Mm-hmm.
I want to do prenatal lactation consults so that we can talk about all these things. We can
Right,
talk
right.
about the positioning, how to latch properly, because
Right.
there is techniques to this. And if you don't know better, you're just gonna
right.
pretend like you're gonna latch the baby to the nipple and then not get the results that you want.
Absolutely. And I think there's a lot of mothers that don't know
They don't know.
better, right? Like myself, I thought it was pretty black and white.
Of course.
I really did. And so if and I'm glad you founded this company because you are able to show it's gonna be raw, right? You're
Yeah,
you pull out your boob and you're gonna show
Absolutely.
how to do it because
yeah.
yeah,
And the truth is, I feel like here in Miami, we don't talk about these things.
a very sensitive topic.
We don't talk about these things. Why not? Like us women, we are so powerful, and this is the most natural thing that us women are able to do.
Right.
So
It
would
is-
this be like, I'm sorry for cutting you off,
Yeah.
but would this be like a Lamaze class for Latch?
Yes, it can be because we do offer the prenatal lactation consult is like that. It is
Okay.
a class where I will be also providing you. I'm in the process of publishing my second book
Okay.
for prenatal lactation.
Okay.
So how to prepare you. So I'm not too familiar with Lamaze class. That sounds familiar, but
Yeah, it's like
Remind me?
a pre-birth class.
That's exactly what this is.
Right.
then.
It's a pre-birth class, and I wanted our audience to kind of get a feel for what you were saying
Yes.
when we talk about before, because it's not just, breathe, push.
Right.
Oh, no.
It's also preparing yourself physically
Absolutely.
for
Mentally.
lactating
Yeah. Oh,
a
yeah.
baby. And so why don't you tell us a little bit about how you offer these classes, like what specifically goes on? Because I think women that are in this process definitely benefit from knowing how it works.
So I want to start off super important information. A lot of people don't know this. These lactation consults may be covered by your health insurance.
Oh, that's awesome.
And no one
Okay.
really knows this, and
Okay.
that frustrates me so much because how is it possible that something that is so important, so natural, so many people don't know that your health insurance that we pay for, you work hard for, you don't know that it's covering something so important. So
Okay.
I want to definitely get that message out there. Latch is covered, is taking certain insurances.
Okay.
Or you go to the link in our Instagram bio where you're able to check. And if you are covered, this is how it goes. I'm gonna find out you're covered, we're gonna book an appointment, and we do offer in-house, so I do go to your house, which is super convenient.
Okay.
Because you don't have to even leave your house.
Right.
So if we're gonna talk about prenatal, I suggest doing this in the third trimester towards the end. So that way, like, we're a little closer and
Right.
your breasts are getting more prepared, and not just at your nipples as well. So I highly suggest towards the end of your pregnancy, I go to your house and we're gonna talk about from beginning to end. We're gonna prepare you on what is colostrum, and maybe many people don't know what colostrum is. You don't automatically just have breast milk. Breast milk is that white color,
Correct.
Many people think it's just going to be breast milk. No, the first milk that comes out is called colostrum, which is called the liquid gold, actually. That's what they call it. And it's yellow in color. So some moms even think that they have an infection right when they when they deliver. Because it's yellow.
Yeah.
And that's the first milk that you see. Like so many people don't know.
They don't know. And how long does that last?
That could be up to 3 to 5 days.
Okay.
And that actually is perfect for your baby because it has every nutrient that your baby needs.
Well, at least I got past that part.
Yes, I mean, it has everything that your baby needs in those first days.
Yeah.
And just in your prenatal, like, there you go. You learn something super important in that prenatal consult. We go over the feeding positions. We prepare you. You don't know if you're going to have a C-section. That can happen emergent. You're going to go through emergency. So we prepare you for the positioning if you're going to have a C-section, if you're going to be, it's vaginal, you know, I prepare you for all of that. I prepare you for the support system. So hopefully, you know, we can prepare your family members, your significant other, things like that. I can also prepare you for pumping. We don't suggest pumping right away, but like, you know, I do, it's like going to school for breastfeeding.
Now, let me ask you, you mentioned that you don't suggest pumping.
Okay.
So I hear a lot of mothers who opt out of the breastfeeding because they're like, no, I don't want any of my kids to. Okay, that's fine, right? But they'll do the pumping, strictly pumping. Now, why do you go against?
No, I'm not against pumping.
I mean,
No. What I meant earlier was if you're going to breastfeed, we don't suggest pumping right away up until your milk comes in. We want to wait till your milk comes in because the baby is what pulls the milk out much faster than pumping.
Gotcha.
I'm all for pumping, but if you're gonna put the baby to your breast, let the baby bring the milk out. That takes about 3 to 6 weeks, and then you can start the pumping. Now, I do have many moms that don't want to put the baby to breast at all. No problem. You can immediately start pumping.
Gotcha.
But it was just like the best pump is your baby.
Is the baby. Understood.
And that's a fact.
Yeah.
But absolutely, I respect if you don't. I have many moms that don't breastfeed and they just go to pumping.
Really quick question. I'm gonna chime in here.
Yeah.
Are you able to offer products also?
Not yet, but that is in the works.
Because I can tell you that 100%, everything you're saying is 100% fact. You know, one of my issues was chafing.
Okay. On your nipples.
Oh my God.
Yes.
I felt like, oh my God, this baby is destroying me. And it doesn't matter whether it was the first one or the third one.
Yes.
And that's how I knew I was doing something wrong. Because
I'm glad you're saying wrong.
Yeah, absolutely. Because you shouldn't feel that. And at the hospital, and that's another thing, follow-up visits. Like, that is so important. Like, once you know, okay, at the hospital, fine, the pre, the during, and then following
up. And that's where it doesn't happen. No, it doesn't happen. It doesn't happen.
So I want to talk about the chafing and the products, but since we're talking about the post, that's the other service that we offer. So it's prenatal. I'm going to start from the beginning.
You're just like jumping all over the place.
No, it's okay.
It's a process.
It just, you know what? There's so much going on in here. And I wish somebody would have been there for me.
Listen, that's why this topic is so important.
Yes.
About, like, I hate that I wasn't there for you back then.
Yeah,
I'm sorry.
But I'm here now. So ladies,
moms,
you're welcome.
Yes, exactly. But I'm going to talk about all these things.
Okay.
But we'll start off with my services. Latched offers prenatal consults that I go to your house or telehealth if your insurance covers. If not, we do accept payment.
Now, I don't mean to cut you off.
It's okay.
I don't mean to cut you off.
I'm the one all over the place.
Because you mentioned insurance, right?
Yeah.
So what about, because I love to play devil's advocate, so what about those mothers that don't have insurance? Do you offer some type of...
So we have payment
plan? Yeah.
Yes.
Okay.
We have our pricing. We have our pricing on our website, latchconsultations.com.
Okay.
So that is the other option.
Okay, gotcha.
But it's the prenatal consult, postnatal consult.
Okay.
Where I go to you after you deliver, and we continue to follow up with you.
Okay.
Most insurances are covering up to 6 visits.
Oh,
are you kidding me?
That's amazing.
That's amazing.
Yeah.
6 visits. That's phenomenal.
Gosh.
So
why didn't you think about this like 11 years
I know.
ago?
I was a baby. I don't know.
She's doing her thing.
And the other service that we do provide, which I know we're skipping around, but I'm gonna go back to that. Is the baby care classes.
Okay.
So that's the other thing that I offer, that I go to your home, and it could either be just you or your significant other or you yourself or the whole family. Up to 10 people. I go to your home and I teach you, this is the book, Baby Care from the Hospital to Your Home. I teach you everything, and your family, mom, dad, uncle, sister, anyone, you know? And I teach you everything up to diapering, burping, swaddling, and most importantly, I teach CPR recommendations
that's amazing.
and choking.
Yeah.
So those are my 3 latched services, which we could go more into depth.
Yeah. No, that's amazing.
But I want to go back to that. The chafing products, that will come eventually. But I want to say, many moms don't know, when it comes to the sore nipples, the best medicine is your own breast milk. And so many people don't know this. Your breast milk is like Neosporin. Your body's Neosporin. It literally, you can save that breast milk, and if your baby has a rash or a cut, you put it on your baby, and I promise you the next day that cut or rash is gone.
That
it's really unfortunate.
amazing.
And I'm really upset. Let me tell you, I'm really upset right now.
Thank you.
No, listen, I'm really upset. Let me tell you why.
I believe you.
I'm heated right now.
I believe
Why?
you.
Because I only lasted 2 weeks. And let me tell you, those 2 weeks were the most excruciating 2 weeks of my life.
I believe you.
And I'm going to be very honest. My breasts were bleeding. Bleeding, okay? And not only is it that, but there's also a depression that comes with it.
Yes. Oh, I got goosebumps.
No, it's very irritating.
Well, do you think the depression is like part of the postpartum?
No, well,
because I mean, for me, that's what I felt. You know, it was like a combination of things, like between the breastfeeding and then the sundown. Have you ever heard of that?
Yes.
Sundown. Like I got a lot of
Yes.
sundown during that lactating period, those first couple of weeks, especially, and
it was due to the post. Well,
that's what
honestly,
I attributed it to. But maybe.
well, for me, it was the fact that I felt like a failure.
Yep.
I did, because my goal as a mother, I wanted to bond with my son in for almost 2 years, like I mentioned, you know, and the simple fact that I couldn't get it, you know, I just couldn't get it. Like he's there and he's feeding, and I'm just like, oh my goodness, when is this gonna be over, right?
Yeah.
So then I would switch. By the time, you know, he went to bed, and then 2 seconds later, I felt like he would wake up and want to eat again, right? So I put him on this one. This one would start bleeding. So then there's no healing process,
Never. Yeah.
right? And so I went to a dark place.
Of course.
I went to a dark place because I felt like a failure.
Yeah.
You know, and I'll never forget, I called my cousin, she's a physician assistant, a PA in New York, and I'm crying, bawling, and I said, I can't do this anymore, I cannot. And she goes, listen, there's nothing wrong with giving formula. If you can't do it, just do it. And I said, no, I want to keep going, but at this point, it was too late.
Yeah.
It was too late because I couldn't bear the pain.
Of course. I'm sorry you went through that.
I mean,
that is horrible.
And the thing is that, you know, I think for us moms that are really like, and I'm not saying that all moms are not health conscious when it comes to their babies, but, you know, one of the issues with my kids was reflux, you know, and having a colicky baby. And so it's so important for moms to know and get this kind of training because the difference between a mom that's breastfeeding and a mom that's offering formula, while they're both beneficial, obviously the baby's getting fed, you know, at the end of the day, your baby tends to be a little bit more cranky when you're giving them formula versus breast milk. You're dealing with colicky babies, and then you're getting the Milacron drops. Who remembers those?
Yeah, I remember.
Milacron drops, and then the baby's spitting up, and then you're going to the pediatrician. You got to change the formula because it's you know, this or that or the other. Yeah. So I mean,
is it because, I don't mean to cut you off, is it because they're not burping the baby well? Is that why there's that reflux?
It can be.
Okay.
But formula, I have a saying. Well, it's not mine. I can't take credit for it. But it's called fed is best, right? So fed is best, whether it's formula or breast. Right. I'm not here to bring anyone down.
Of course. This is a safe place, by the way, guys.
Safe place. And this is safe, and Latch is safe.
Absolutely.
I want to say that. But formula, the truth with formula is that it's heavy. It's heavy on the stomach.
Okay.
So the colicky can come from, picture this, a baby's born, with a sterile, I don't know if you guys know what sterile, sterile means completely clean.
Clean, absolutely.
A sterile stomach.
Mm-hmm.
And you immediately go and give, I don't know if you guys have ever checked what's in your formula, but corn syrup is in our formula. Corn syrup.
Oh man.
And we're giving this sterile baby corn syrup. Like I said, I will probably have to give my baby formula one day too. I'm not against it. I'm just saying it's important to be educated.
Of course.
So if you want to ask, why is my baby colicky? You have to think, what am I putting inside my baby? So all of these additives is in the formula. It can cause the baby to be colicky, the baby to be upset. This baby's not used to, this baby's used to natural. The baby was being fed with the umbilical cord inside. And you automatically go and start giving this baby all these additives. It's gonna, not always, but it can upset the baby. There's other.
I've seen a lot of this through the years. Between my 3 kids and of course the family, children and friends and family having these conversations, and it's usually those babies that are formula fed that tend to struggle more than the babies that are breastfed. Maybe it's the formula we're using. I wouldn't know. Yeah. But I definitely think there's a correlation between colicky babies and babies that have reflux to versus babies that are.
And don't get me wrong, I've taken care of moms that the baby can be colicky from the breast milk. Okay. And that just means that there's, the baby is having a hard time digesting, because that with breast milk there could be issues with like a milk protein. Like you could go and that's like a whole other story, but yes, I think that there is a correlation between formula and a colicky baby. Right. Okay. And I think it's just important to educate, because I've noticed working here in Miami, we're surrounded by many different cultures. Absolutely. And many cultures automatically go to formula. Yeah. And for many reasons. It's easier. And I go like this because, let me talk about why I'm saying this. How is formula easier if this is free? This is free.
For real.
Yeah. It's free. You don't have to pay money. It's easier if you have help and support and a lactation consultant. Right. Now, it's not easier if you don't know what you're doing and you're bleeding. Correct. I get that. Yeah. That's where I could get why formula would be easier.
And there's never going to be a shortage of it, really.
Never.
You know? Like we had a couple years ago.
You can't produce anymore, right? Right.
But that's also another misconception. Many moms, going back to the culture, a lot of moms immediately start off saying, I don't have milk. Or I'll say it in Spanish as well, because it's a lot of the Latino culture. No tengo leche, right? And that's a misconception, because remember how I said colostrum's the first milk? Right. A lot of moms immediately think that they're going to come out with flowing cow, like being a cow. And that's not the case. If you're educated, I'm going to teach you that at first it's going to be drops, little drops of colostrum, until 3 to 5 days. That's a long time, guys. Yeah. Like when you have a baby, 1 hour is a long time.
Oh my God.
So in 3 to 5 days is when your milk starts to come in. Yeah. And that's when you become the cow, like they say.
Yeah, I would know. It happened to me with my first one. I gave birth, and I had no choice but to give her formula, because I had, as a C-section mom, I didn't produce right away.
It's okay, yeah.
So I leave my baby with my ex-husband, and I kid you not, I go to the grocery store just with my mom just to grab a couple things, and all of a sudden, who remembers the grocery stores that had the mirror over the meat aisle? Anybody? No.
The mirror over the meat aisle.
Yeah. And because nothing had come in, I thought, oh well, nothing's coming out. You know. Suddenly, I'm in front of the meat section.
Oh my God! I already know where this is going.
And and of course, I call my husband at the time, and I says, "Is the baby okay?" She was screaming, and I guess I was still connected.
Yes.
Even 5 days later, we're still and I just.
Oh my God.
And things just
at the supermarket. So you're drinking.
I'm like in front of the meat aisle. Yes. And I'm like, oh my God, I was mortified. Mortified, people. But it was it took 5 days.
It took 5 days.
Yeah. That's the part.
Yes.
So what do you do?
What do you mean?
Well, I mean, you talked about on the first couple of days it's just a tiny drop.
Okay, so what do you do on those days?
Do you give the formula or you don't?
It's to each their own, right? But if I'm going to educate you and you want to, your goal is to exclusively breastfeed, there is no need to give that formula. So this is, I don't know if you guys have ever heard this before. Feed on demand or breastfeed on demand.
Yes.
Okay.
On demand means whenever the baby wants.
Oh, yes.
Right.
There's a reason for that, right? This we're talking about mammals here, right? Like let's go down to like I'm
History.
talking about mammals.
Okay.
These mammals immediately latch on to the mom. Like I don't know if you've seen videos.
Yeah,
like, they
yeah, of
immediately
course.
latch on and they're
Animal
on
Planet.
Yes, Animal Planet, guys. And they immediately start sucking, and they're
Yes.
probably sucking for like literally 24 hours.
Yes.
There's a reason for that. They are bringing out that milk.
Okay. Even if nothing is coming
Even
out.
if, but there is something coming out.
Oh, there is
the
something.
colostrum,
Okay.
which is what the baby needs in that moment.
Gotcha.
And the baby, the reason why the baby's always, a lot of moms think this, right? They want to be breast exclusive. They come, they deliver, and they're like, okay, I'm going to be breast exclusive. I'm going to do this, right? And they start feeding, and now an hour later, the baby's hungry again. And an hour later, the baby's, and the mom's like, why is this happening?
Right.
What's going on? The process is the baby's the one. Remember how I said earlier that the baby is better than the pump?
Yes.
The baby sucks for
okay.
3 to 5 days so that the milk comes out. Now, many moms that say, my milk's not coming, it's because they're tired and they're not putting the baby to the breast
They're not
every
letting the
hour
baby
long enough.
on
or-
demand.
Okay, understood.
I hear you. I know it's hard.
Gotcha.
I know it's hard.
So even if, this is great information.
Yes.
So even if that mother produces the colostrum,
Yeah.
a little bit
drops.
goes a long way for the baby.
Absolutely.
Okay,
Goes
but even
long-
though the baby might require it a lot more.
Yes.
A lot more.
And it's the natural process.
Right.
Like that's what we're supposed to do as
Okay.
mammals.
Right,
Like,
right.
It's the whole purpose of breastfeeding and a fun fact, when you're doing it for your second time, it's going to happen much sooner.
Gotcha.
It won't
That's
take,
true.
Yeah.
Gotcha,
It won't
gotcha.
take 3 to 5.
Yeah, it was the first one that happened with.
Yeah. The first one's rough, guys. And
Yeah.
but that's what Latch is here for. Like, so many women, why are we not educated on this? Like, why don't we know these things?
Well, I mean,
And it
you remember back
frustrates
in the
me.
day, back in the day before Latched, there was La Leche League.
Yes, and it still exists, yes.
And
what is that? What is
the
that?
La Leche League showed up to my room post-delivery and tried to assist me,
Mm-hmm.
right? But the nurse was not very patient with me. I will have you know. And I don't know who was more frustrated, the nurse, me, or the baby.
Mm-hmm.
It was just, we were having like a whole, and I started crying at
yeah.
one point.
I believe
You know,
it.
this was with the second one because they were trying to be helpful, but things weren't just the boppy, and then, yeah, it was just, and so I ended up giving up. She did latch on for a while, and I think I breastfed for maybe a week or two, but then
Yeah.
the chafing, and then the engorgement.
Of course.
That was another thing.
Yeah.
That was just like,
Too much.
I don't know. And then I started pumping
Yeah.
because
It's
I
good
wanted
that
to.
it's good that you mentioned that, because when I gave up, okay, I want to say 2 or 3 days later, this is when,
Okay.
man, when I tell you it.
All like a couple bra sizes
I mean,
there, like,
yeah.
oh my god, I don't know what to do with myself. You
Yeah.
know, like, whoa.
and yeah, so maybe, if I had known this information, if the lactation consultant at the hospital was a little bit more patient and informative.
Yeah.
I went to her house after we got home.
Yeah, or
to
even
just
give
come
me a
in and
call.
say, hey, what
Yeah.
are you,
But
how
not
you
even
doing?
that, not even
Yeah.
that. I would have appreciated a call,
Yeah.
and say, hey, Sasha, how's it going? This
Yeah.
is your first baby. How's the breastfeeding
Yeah.
going? And I would have said, you know what? It sucks.
Yeah.
I'm in pain. Can you help me out?
Mm-hmm. I believe you.
You know?
I love that we're talking about this because that's why I started this.
Yeah.
I worked, like I said, as a nurse with moms and babies, and I'm going to be raw right now. The truth is, it's hard in the hospitals.
Absolutely.
As a nurse, right?
Okay.
As a nurse, like a lot of nurses are overworked.
Okay. Okay.
And
So that time
It's a lot.
it's not there.
and we have so many patients, and
okay.
breastfeeding takes time. And I love that you said that, like, you felt like who was more frustrated, me, the lactation consultant, or the baby.
Yeah.
Guys, breastfeeding is supposed to be
A bonding,
relaxing and
you know?
bonding
Yes.
and beautiful.
Absolutely.
And that's what sparked this idea for me, because why are like moms, like, it's unfortunate that like the help that they're getting
Right.
sometimes isn't even helping.
Right.
You know, it's making it worse,
Right.
actually. And I needed to make a difference.
Right.
And I'm the kind of person that when I want to do something, I'm going to do it.
Right.
And that's why I'm doing this.
Okay.
Because
not to cut you off,
Yeah.
but I want to ask you a very off the wall,
yeah.
maybe a little bit of an inappropriate question, but I believe that this is a very valid question for this topic. Are the different types of breast a factor? Because from what I understood,
Great question.
From what I understood, some moms have it easier because of the shape of their breast versus other moms.
Absolutely. The answer is yes. There's so many factors that play into this. Some moms had a breast reduction before, or breast augmentation, or surgery, or because there's so many things. Some moms have a larger breast on this side than this side. There's so many things. So yes, it all plays a factor. Some moms have very large breasts, and that's hard to feed a small baby like this.
Okay.
But if that's what I'm a lactation consultant is, I'm a board certified lactation consultant. I took a board exam to help. So there's a reason why this exists, right?
Yeah, right.
It's because I'm educated to know all about these things.
Right.
So to answer your question, yes, some women do have it easier, that they have the perfect, I don't like to say perfect, we're all perfect.
Right, absolutely.
But you know, I mean, like,
yeah, I get that.
the stereotypical perfect size breast, it's probably easier. Perfect size nipple. Guys, there's so many size nipples out there. There's really large nipples that a baby's small mouth can't latch onto. I'm here to help with that.
But in essence, regardless of the size, they're still able to do that.
There's just tricks.
They're just
and it's going to be a little more difficult.
Okay.
And with Latched, I'm always going to be honest with my patients.
Okay.
That's something I want to talk about. Like, I feel like in this industry that Miami doesn't really have.
Okay.
But if you go to California, there's so many lactation consultants.
Okay.
But in Miami, what I've studied about lactation consultants, you know, I'm just going to say it like this.
Yeah.
I'm very, like, honest.
Yeah.
Black and white.
Say it.
And
This is
a
word
safe
on the
space.
street.
Yes.
This is
Yes.
we
This is
want
a
to
safe
know the
space.
raw deal.
Yes.
Tell us what it is.
Yes, I'm real. And like maybe I'm not supposed to. Maybe I'm supposed to be like, breastfeeding's beautiful and wonderful and la la la. But I'm not like that. I'm gonna be here. I want to be here for my patients through the good times and the bad. I'm not just your lactation consultant. I'm borderline your therapist.
Yes.
Not legally. But you know,
we're therapists too, as realtors.
yes,
there you go.
Exactly. But that's what Latch is all about. Latch is here for Miami for women to feel heard, to feel safe, to know that breastfeeding is hard as hell. You're gonna go through hell, like
You're gonna
your
cry.
husband might not even be helping you. You feel alone. You have kids crying everywhere, and you want to breastfeed. Latch is here to understand all about that. We're here to empower you through this journey, and just be here. If you want to quit breastfeeding after 2 weeks, I'm also here to help you wean, because you went through engorgement. You don't have to go through that.
So, quick question, and this kind of throws me back to that movie. What is the longest time a mom should breastfeed? What was that movie with Adam Sandler?
Oh my
that the
God.
4-year-old was latched on.
Daddy. Something daddy.
Yeah.
or-
Was it that? I don't think.
With the little boy.
Yes.
The little
Yeah.
blonde boy.
But you know, it was like a family movie and grown-ups.
Oh,
That's right,
Oh.
guys. If you haven't seen it, it's a must-see. Just put it on your a must-watch.
yeah.
So this 4-year-old is latched onto his mom, and everybody's looking at the mom like, "What in the world is wrong with
Yeah.
you?" And then they start weaning this baby off the boob and giving him, you know.
So like that's such a sensitive topic, because
what's too long? Too long.
the truth is there is no too long.
There is no too.
Honestly.
Okay.
It's unfortunate. I know. I hear you.
This is
that's-
when my old Hispanic Latina side comes out. I'm
but
like,
look,
absolutely not.
That's
They
what I'm
cannot.
saying. The culture.
No.
Like I hear you and I respect that. But the answer is
Indefinitely.
indefinitely.
Okay.
Like we're going back to mammals, right? Like
Right.
you can do it for however long you want. I get it.
Annalise,
And
like though, seriously,
but
like, can you imagine Miami walking around with a bunch of 5-year-olds
No.
latched on, like?
But you know what? I know
a lot of
But
people,
some
they
people-
do it. They do it.
I hear
They
you.
do
I
it.
get it. But I'm gonna be honest with you. I'm not here to discourage that.
Right,
because
right.
Okay.
I hear you though. Like, I respect it, but I'm not here to discourage it because that's the thing. I've noticed a lot in Miami. Why are we so like we tear? I'm sorry. I don't mean this the wrong way, but like we tear down other women's. Like, we don't talk about these things. Like, some moms want to breastfeed on. What if they want
Well,
to
it
breastfeed
just
till
doesn't
3?
seem normal. If your
Right,
kid has teeth
Yeah, but it.
and it's able to chew,
Yeah.
and then wick. Women, infants, and children
Yeah.
recommend that you start giving your baby solids at 6 months.
Yeah.
You know, if your kid's 5 and it's able to chew rice and beans,
They don't need the breast milk anymore. If that's the answer I can give. They don't need it
but
at that point.
so that's why I'm asking, like with what's the standard?
The standard. So the American Academy of Pediatrics says you should breastfeed up to 6 months. That's the most beneficial for your
Oh,
baby.
okay, okay.
Look at that.
At least, if you can, 6 months. If you do one day,
Okay.
that's enough.
Okay.
You know what I mean? Like, we're not here to like
Right,
tell
right,
you.
right.
But they say suggesting up until 6 months to a year.
Okay.
Oh, years.
That's like the most beneficial for the baby.
And what's the health benefits? Like on the the specificities. I'd love to hear about that.
Absolutely. So the health benefits when it comes to breastfeeding that formula cannot give you. Let's talk about my favorite, antibodies. So
Okay.
the immune system. Going back to what we said, that the baby's stomach is sterile.
Sterile.
Immediately, if you start feeding your baby, if you start breastfeeding, you are just pumping this baby with a healthy immune system. Our bodies are so beautiful that we are able, like as women, to give the perfect antibodies that the baby needs. So that's number one. Breast milk provides everything: the carbohydrates, the proteins, the fats, the vitamins, the minerals. It has all of that. And it's so perfectly made for your baby. For
Okay.
example, your body knows if your baby needs more carbohydrates that day. And it will make more because your baby needs it.
Look at that.
Interesting.
It's the beautiful
My mind is
bond.
blown.
I know. It's
Yeah,
so
it's
mind blowing.
amazing.
Wow.
Yeah.
It's the beautiful bond between the mother and the baby.
Right,
that
right.
it's the perfect combination that it makes everything that the baby needs. So, fed is best, but formula cannot do that.
Right, right,
So
right.
that bottle is always gonna have the same thing and does not have antibodies. So I was fed formula.
Right.
I'm
As a-
sure
as
we
a
all
baby.
were.
Okay. Yeah.
I was fed formula, and I mean, I'm okay, but I do have a lot of allergies.
Okay.
I do have ADHD.
Okay.
I do have anxiety.
Okay.
And there's been some studies that show that breast milk helps prevent all of that. Helps with the allergies, asthma, respiratory disorders, mental health. Even they're coming up with some studies about social, like
Being
the way they're
an
able to
extra-
socialize.
Oh wow. Okay.
Which they're studying that, but like it's just
and
magnificent.
even the little tubes in the
Thank
ear
you. Yes, ear infection.
from drinking the
Yes.
bottles. A lot of kids under 2
Right.
Yes.
Right.
need the little tubes
Yes.
because the formula gets in here, and if they catch a cold, that whole
Exactly.
combination.
Well, is it because also they're drinking this
Right,
bottle
they're
while
laying
they're
down.
Can
sleeping
be.
and laying down?
But breastfeeding is, thank you for mentioning that, because that is a part of, I actually have this all written down somewhere.
Right.
Yeah.
It prevents ear infections as well. And then not just that for the mom, it also helps moms prevent type 2 diabetes, high blood pressure, postpartum depression.
Wow.
Although it depends if you're going through
No,
pain.
Right.
it was because of this,
Of
it was,
course,
right.
but
yeah, but I'm sure it can go on.
it can
to,
get better.
Yeah, of
like if
course.
you're having a better experience.
Yeah, yeah.
Those are so many good benefits that breastfeeding gives
Right,
to both
can
the
go-
mom and the baby.
So for educational purposes, for if a woman is going through the engorgement,
Yeah.
right? How do they get rid of that? What is the process, and what should they do?
Okay, so that's great to ask. With engorgement, what we say to do is we say to put cold compresses
Okay.
to relieve that pain. And now it depends. If you're trying to wean off, if you're trying to stop breastfeeding altogether, then we say to wear tight, like a tighter fitting bra,
Okay.
and wear the cold compresses to relieve, and just to slightly massage
Okay.
to release a little bit of milk
Okay.
till you have relief.
Okay.
And then little by little, like, you wean off. That's what the term is called, weaning off.
Yeah.
And many women don't know that. They just go through the pain and they just wait until their milk stops, and that's dangerous because you could have mastitis. I don't know if you guys have ever heard of mastitis.
What is exactly
Mastitis is an infection of the mammary tissue.
Mm-hmm.
So in other words, an infection in your breast.
Okay.
And that's dangerous.
Okay.
You could become, worst case scenario, you could become septic. And
Okay. Which is a blood infection.
yeah, blood infection.
Mm-hmm.
And it could get very dangerous. So Latch does help with the follow-up visits. We do
Okay.
help you with that, with the engorgement and with the weaning process. Because a lot of moms just cut
They
cold
just
turkey.
call cold turkey. Yeah.
And that's not recommended for physical aspects and emotional aspects too.
Right,
it's
right.
it's very it affects women when you stop cold turkey. It affects both you and the baby because now the baby's suddenly stopping. It's
Like what's going on?
Yeah.
You know. I
So
was used
there's-
to a boob, so.
there is processes to
Yeah, yeah.
help you.
I want to ask you one more off the wall question. It's my off the wall day.
Mhm.
Okay?
Off the wall
It's
day.
okay. It's my off the wall day.
Good.
So I've heard that a woman can start lactating even while not having a baby.
Oh my god, I love that you asked me this.
Yeah.
Uh-huh.
So and this question is really more for moms that are doing like the adoption process.
Yes.
You know, that they want to have that bond with the newborn that they've just adopted.
Yes.
Tell us a little bit about that. That's got to me when I heard about that, that was pretty cool.
No, yeah.
Mind
Yeah, I was
Yes,
like, this can
yes.
really happen.
Yeah, I see this on TV all the time.
I find it
Like,
funny.
but I see like with cats and stuff, and like
yeah.
With cats.
Like
yeah, like
If
you
you're
know,
No, I'm not a cat person. I'm so sorry.
No, like like
so I
Animal
don't know.
Kingdom. Stop. Like Animal Kingdom too. Like it was just one of the things where like the dog will adopt the cat
Yeah.
and breastfeed the cat.
Yeah.
Okay.
Yeah.
No,
But
no.
usually they're lactating.
Yeah. Well,
Already.
previously, yeah.
Yeah. Okay.
No, but I find it funny you ask me this because when I was in the process of studying for my board exam and learning everything I had to learn, as I mentioned earlier, I don't have babies, but like I borderline almost wanted to start lactating so that I could learn. Like I could do it. I didn't do it, okay? But yes, it is possible, and the way that it's possible is by just stimulating. So if I were to start breast pumping right now, every 3 hours, because that's what we suggest. The cycle is every 3 hours
Okay.
in the 24-hour period. It might take a long time, might take even up to a month or so.
Okay.
I could start lactating and I could start preparing. Now,
That's amazing.
studies show
That is.
it will not be the same volume
Okay.
of breast milk as a pregnant woman that birthed a child.
Okay.
So when if I were to be helping a mom or well, it has a mom. Well, actually, that's another topic.
Yeah.
I read
For another episode. Stay
Another
tuned.
But for a mom that wants to adopt, I would like mentally prepare her that this is possible, but we might not be able to give your baby the amount that they need.
Okay.
So in that sense, we will have to supplement. That's what the term we use, supplement with formula. Supplementation means like give a little bit.
Oh, mixed. Like a
mixed.
mix. Okay. Okay.
Usually,
Okay.
that's what the studies have shown
Okay.
because it's not natural. Like you're not pregnant, but it is possible. It is possible.
That is so
And it's all
interesting.
by stimulating. It goes back to what I was saying. Like
The
when
human
women
body
say
is
that
so
they can't.
amazing.
Yeah, when women say they don't have breast milk, they're not able to. It's not true. It's just that you weren't stimulating enough. You weren't
Okay.
educated and told. For the next 3 to 5 days, you're gonna have to stimulate until your milk comes in. But yeah,
That is-
a
that is-
non-pregnant
That is
mother
awesome.
can do this.
That is very, very cool
Mind-blowing, I
and
know.
mind-blowing.
Yeah,
Yeah. So, do we have a recommended? And I'm sorry.
That's
Do we
okay.
have a recommended bank now where we're still holding breast milk from for moms that donate breast milk? Because you mentioned that you could do a combination, but I know that there was a lot of moms back in the day. I don't know so much so now, hence the question, that would have like a bank. They would like order
So
breast milk from other moms.
So I'm gonna be honest with you. I'm only experienced when it comes to the hospitals. I haven't found. Don't quote me. I don't know. I haven't found one in Miami.
Okay.
But donor milk still exists, and it's highly recommended
Okay.
in the hospitals. they go through many tests.
Okay.
And you obviously have to give consent before. You have to know that there are some risks.
Okay.
But it is highly.
Okay.
Some risks are, if the testing wasn't done correctly, and there could be like what's it called, like an infection or something. But like the chances of that happening are so minimal that I personally, I would give donor milk to my baby. If for some reason, let's say you said the C-section, and I'm not able to feed on demand so much, and I really don't want to give formula, I would give my baby donor milk.
Okay.
In the hospital, they are, not every hospital, but many right now are offering donor milk.
Okay.
And they don't give it to you when you leave. So that's why I don't know the answer, and I thank you for asking me this, because I will find out about donor milk banks here in Miami.
Okay.
So yeah, that it does exist. It does exist. I just don't know here in Miami.
Yeah, and where to order it.
Yeah, but I've heard that it's very expensive.
I bet.
Oh, really?
Very. In the hospital, it's part of the experience.
Right. Yeah.
But if you were to do that outside by yourself, it is
expensive.
So ladies, and I just want to make sure that we got this right. A woman could give birth to a baby at a local hospital and ask for breast milk as opposed to bottle fed, like formula.
Yes, and the term is called donor milk.
Donor milk.
Okay.
Not at every hospital, but there are many. You would have to ask, but yeah.
Okay.
Understood.
Donor milk. And yes, that's another thing that it will be in my prenatal book that I'm currently almost going to publish. I have a topic about donor milk because many women don't know about this, and they're automatically pushed onto the formula. And you can give donor milk before formula while your milk production is in process.
Okay. Wow. So what would you tell a mom who might not have all the resources that some of us have, to get the information for breastfeeding? And so what would you tell a mom?
When it comes to that, the resources, step one, hopefully women have a doctor, right? I'm hoping that these women have a doctor. That's your resource number one. Any questions that you have, they are there to help you. Latched, I mean, that's what that's what we're for. Like, if you have Instagram, if you have social media, if you, let's say your insurance doesn't cover, and you don't have the resources to, pay.
Right.
You can learn a lot from my Instagram, that I will be posting education and
okay, awesome.
And maybe one day I'll be doing a live video and things like that. So
don't forget to mention your Instagram.
Thank you. It's Latched Consultations on Instagram and Facebook. And we do have the website latchconsultation.com.
Okay.
So that's where you can find me. And yeah, that Latch is here to educate you as much as we can.
Okay. And are you available 24 hours, Monday through Sunday type of thing? What are your hours? Because that's very important,
yes, So I am available Monday through Sunday.
Okay.
And I did answer a mom the other day at 4 a.m. So
awesome. That's amazing.
Oh, I love that. Thank you.
I'm very passionate about this. I don't know if you guys have noticed.
No, I can tell.
I'm very passionate.
Yeah.
Absolutely.
Like,
it's pouring out of your
exactly.
Yes. And you know so much.
Yeah.
Which is great, because I know we've asked you some really tough questions.
And this
today.
is unscripted, by the way.
Unscripted.
Yeah. So
I mean, I'm here for you guys. I'm here for moms. If I don't answer at 4 a.m, sorry, I am sleeping. But if I see it, I'm gonna answer you.
Right.
I just want to make a difference in Miami. I really want to make moms feel okay and heard, and they're not alone. And I hope to create like a community with Latched where, like, I don't know, I'll come up with an idea so that maybe a Facebook group where like all of my Latched moms can communicate with each other. And
absolutely.
It's just not right. It's just not right that we don't talk about this.
Right.
And Latch is going to talk about it, and we're going to educate you. We're going to make you uncomfortable.
Absolutely.
We're going to talk about nipples and breasts and all the above, because this is real.
Right.
This is happening. We've been doing this for millions of years. So.
Absolutely. And you know what? We have healthy babies as a result of that. So, and at least we want to say thank you.
Thank you
so much for visiting with us today. This has been...
Wait, hold on a second. You also need to give props to your soon-to-be husband.
Oh my goodness. That's right.
Yes. He's part of this too,
right? Yes. So I will mention... I am the nurse. I'm the international board certified lactation consultant, but my business partner is my husband.
Okay.
Who, has the business brains in this.
Okay.
And he's my biggest supporter.
That's
and
awesome.
he knows almost everything that I know because he's listening to me talk all the time.
Yeah.
He will not be there for our consult. Don't worry. It's just me. But just know that he is your supporter and he's rooting you on too.
Awesome.
And nothing. He is my business partner. We're doing this together. This is our baby. We
Yeah.
don't have a real baby yet.
Yeah.
Well, we have 2 dogs. They're our babies.
Well, hey,
There
there
you
are
go.
babies too,
Yes,
you know?
but
Yes.
this is our baby together. He's pushed me to realize that I can do what I want. With nursing, I can grow and I started my own private practice. So
That's
thanks
awesome.
to him.
That's amazing. That's
Yes.
amazing.
Well, congratulations.
Congratulations.
You're
And
doing
we wish you
great.
the
Thank you.
best. You know?
Absolutely.
We're supporters, so anything you need, we are gonna put you on blast
Thank you.
because again, it's such an important topic, and a lot of people are just so scared and feeling ashamed. And again, like myself, I didn't know what to do, and I wish I had somebody like Annalise at the hospital or even at my home to really educate me and help me through the process. So thank you. I mean,
you. We're so
again, tell
psyched.
us where we can find you,
Yes.
stalk you.
And one more thing I want to mention
Not
because it just
literally.
came to me. No.
Latched.
The book. Actually, I will have it on sale on Amazon April 19th.
Get your
It's
copy,
Amazing.
guys.
Get your copy.
Yes.
There's our fabulous Annalise back
Yes.
here.
And another thing I want to mention that just no one ever thinks about, you could even buy this for expecting moms
Yes.
as a
Great
gift.
gift.
And you could even buy a baby care class for mom as a baby
Awesome.
gift.
That's a great
registry.
idea.
Oh, that's
super
nice.
cool.
Great idea.
Or prenatal, postnatal lactation consult. Those are great ideas
Amazing.
nowadays.
Amazing.
So
That's
many
a good-
people are
that's a good
gifting
gift.
like the
Yeah,
same
it is a
thing
very
to
nice
everyone.
gift.
Yes,
but
yes.
this is so if you go to my website, latchedconsultations.com, you can book. Not book, if you want to buy for someone, you can buy it. You can message me. We could talk. I give you a gift certificate. But if not, and you are the expecting mother, you go to my Instagram, Latched Consultations. Check your insurance coverage. Link in the bio. DM me if you have questions. And thank you.
That's
it.
amazing.
That's a great baby shower gift
Yes,
too,
baby
right?
shower too.
Yes.
That's
what I'm
awesome.
Our next baby shower,
Absolutely,
we're gonna,
absolutely.
yeah, definitely,
absolutely.
we're gonna definitely recommend. Thank you again
Thank
for
you.
everything, and thank you to your
Frank.
husband for being such a great supporter.
Thank you.
You guys are doing an amazing job.
together.
Ladies and gentlemen, this is Word on the Street.
Thank you.